Every 40 seconds, someone in the United States has a stroke, and it's a leading cause of disability and death. But the good news, stroke is often preventable and highly treatable when caught early. In honor of Stroke Awareness Month, we've got Dr. Brandi French, a neurologist with MU Healthcare, to help us better understand stroke risks, warning signs, and what to do in an emergency. So let's start with the basics. What exactly is a stroke and what causes it?
Well, so a stroke is when there's a part of the brain that doesn't get any blood flow and doesn't get any oxygen. And there are two kinds of strokes. There's the one that people think of, the blood clot kind, where blood doesn't get anything through. It's just like a plumbing problem. But there's also the bleeding kind of stroke, and that's 1 out of every 5. And that happens when a blood vessel starts to get leaky or may even rupture. So in both cases, it's the same. There's just not enough oxygen or blood getting to a part of the brain, and that part of the brain dies. And so at MU Healthcare, we have a lot of resources to take care of those kinds of strokes. We have a comprehensive center that will treat at least 1,000 stroke patients in the coming year. And we see the full spectrum. We see everything from blood clot kind to all of the different bleeding kinds as well.
So a stroke is often thought as something that happens to older adults, but younger people can have strokes too, right?
Oh, absolutely. And you're right. It is turning into something that does involve more and more younger people. So I see people in their 30s and 40s or even 50s coming in with strokes. We get some teenagers even. Those are pretty rare, thankfully. This is probably a result of just kind of the usual things. You know, we're not as active. We don't move as much as a society. But things like high blood pressure and cholesterol and diabetes are becoming more of a problem in younger people because of the way that we just change our lifestyles. So things like being overweight and smoking are some other of the things that we have to think about. The good thing is that there are lots of ways to prevent stroke, even when they're younger people. Younger people, we have to think of all sorts of different causes, though. I mean, even things like migraines or blood clotting problems. I guess the point is that you're never too young to have a stroke. So you really have to think about that. If something just doesn't add up and you're not sure, trust your gut, call 911, get into the emergency room and see somebody about it as quickly as you can, because we can do so much more when people get to the hospital early.
What are the warning signs of a stroke that everybody should know?
Everybody should know to be fast. I mean, that's the whole point with stroke, is it happens suddenly and you need to get the most urgent care. So be fast is the way we remember it. So B is for balance. So a sudden trouble with dizziness, you can't walk as well as you could. E is for eyes. So that's a sudden problem with the vision either in one eye or both eyes. Maybe it's double vision or blurry vision. F stands for face. So if part of your face is drooping, you can't open your eye, can't close your eye properly, the lower part of your mouth is drooping or maybe drooling. A is for arms. So this can be weakness in one of the arms, or maybe it's just numbness on one side. Speech is the S. So whether it's slurred speech or simply can't even find the words that you want to say. And T is time. We just want to focus on that so much. It's so important to get in soon. So when you hear things like time is brain, that's what we're talking about. Get in and give us all the time that we can to get you better.
So what can people do to lower their risk of having a stroke?
I think really staying on top of your health and keep in good contact with your primary care physician. And so these are things like keeping on top of blood pressure, cholesterol, blood sugars. I joke with my patients and say, if you want to put me out of a job, lowering your blood pressure, cut your stroke risk by about half. So it's very, very important. So know those numbers, know what your primary care physician has to say. And there are even screenings that we do periodically up at MU Healthcare, even the Know Your Heart, Love Your Heart cardiac screening. A lot of those risk factors for heart disease and heart attacks are the same ones that we treat for people who have stroke. Other ways, don't smoke or give up smoking if you do. Try to eat healthy, move around a little bit more. There are certain heart conditions that raise your risk for stroke. So something called AFib, it's that fluttering in your heart or the palpitations that some people feel, especially if they're up and very active. Those have a very specific way of trying to reduce the risk for stroke that comes from that, and your doctor is very well versed in what those are. So stay in touch with your primary care doctor. All those little things matter.
MU Healthcare is certified as a comprehensive stroke center by the DNV. What does that exactly mean for patients?
So what that means is that you are coming to a place where you're going to get the highest standard of care. And DNV is a group that comes and they survey us once a year, and they go through absolutely everything that we do when it comes to taking care of people. So you know that you're going to have the best people following the best protocols, giving you the best types of medication, all the way from all the bookends, from the very start when you come to the emergency room to the time you're discharged from rehabilitation. It means we follow very, very strict standards, and we do the best that we can to give you everything, every chance that you have to recover and get better. I think, the biggest take-home messages are that staying on top of what seem like such simple measures like blood pressure, like cholesterol is, I'll take care of that another time. No, you got to stay on top of that sort of thing now, because it's easier to fix things before they become a problem than after they already have. And that stroke can happen at any age. And it's not your job to figure out whether or not you are having a stroke. That's my job. And I really want to see you, because I don't want to see you a day and a half in when I don't have anything else to add at that point. I really just need to see people as soon as they can, because time is brain. We lose millions of nerve cells just every minute that people are having a stroke. And we've got so much that we can offer in the very beginning.
To learn more about stroke care and prevention at MU Healthcare's Comprehensive Stroke Center, visit muhealth.org/expert stroke care.